Welcome everyone to our behavior management webinar series with Dr. Clara Ricketts. In a moment, I'll be introducing her. My name is Kamika Ruth Taylor. Welcome everyone to our behavior management. I am a Jamaican entrepreneur and also an educator, and I'll be your host for this evening. I will introduce Dr. Ricketts shortly, but let us know where you're joining from. The program this evening, our webinar, we are also catering to members of the deaf community. So if you could, we're spotlighting our interpreter, but you could also hover over Miss Vendita Mackenzie's profile picture, and where the three dots are, you can pin her so that you're seeing her at all times. So welcome one and all. I see we have 16 persons joining us, and we know many persons will catch the replay. So let's get into our presentation. I'll just introduce Dr. Ricketts briefly and take it from there. One moment. I am not seeing, I'm not seeing, okay, here we go. All right, so this evening's webinar is about helping children with behavior challenges to behave and learn. And our chief presenter is Dr. Clara Ricketts. She's a behavior management specialist and an author of the book, Yes, They Can, Working with Children with Learning and Behavior Disorder. So this webinar this evening is just going to give you a foundation for behavior management, and we're going to have others in the series, and you will hear more about that. As I said, our interpreters for this evening are Miss Vendita Mackenzie, Mrs., and Mrs. Heidi and Mitchell Dillon. Mrs. Mackenzie will do the first part, and then Heidi will pick up at the question and answer segment. So let me introduce our main presenter for this evening. Dr. Clara Ricketts has a degree in transformational leadership. She got that from Bakke Graduate University. That's where she did her doctoral program. She's been a special educator for over 48 years and a principal of special schools for over 45 years. She founded her own school, Shore Foundation Educational Center. She specializes in behavior management. She's mother to a son who was diagnosed with ADHD. She's a speaker and mentor and one of the leaders at Mambe Park Baptist in Kingston, Jamaica. Her book, Yes, They Can, was an Amazon best-selling book for a while. It came out in 2019, and here is what Dr. Gwen Dewey of Bakke Graduate University had to say about the book. She says, this book is joy and hope giving, not just for classroom teachers, educators and parents, but for all of us committed with the conviction that learning disabilities and behavior challenges can be overcome. And these children can succeed and become productive and contributing members of society, given the necessary support. The author shares her experiences both as a parent of a child with learning disabilities and teacher, detailing proven effective strategies as evidenced by student outcomes and testimonies of children, parents, and teachers in Jamaica. So the webinar is also based on the book, and if you're interested in getting the book, it's available at Brian's Bookstore in Jamaica for $2,500, and it's on Amazon in Kindle and paperback, so you can go there and make your purchase. Without further ado, let's send up some Zoom claps to welcome Dr. Clara Ricketts.
Okay. Thank you very much, Miss Kamita Ruth Taylor. Thank you for your role in bringing this webinar to pass. Family, friends, parents, teachers, I welcome you and thank you for coming to this webinar, gracing us with your presence and for the support that comes along with it. I want to make special mention of the staff, parents of Shore Foundation Educational Center, as well as my sons, Richard and Romain, who are key players in what I am doing at this time. I continue also acknowledge the presence of our interpreter, that deaf persons in the audience, persons with whom I have been working for years, can also benefit from this webinar. Now a little about me. I thank Ruth for her introduction. I'm giving foundation about myself, my achievement, and my work. But this evening, my focus really is truly on behavior management. And my experience with behavior management started approximately 55 years ago while in Teachers College. As I began to learn about the discipline, I began to practice it at home by establishing what we call duty rosters for my younger siblings. My sisters Winsome and Rosemary may be on this platform and can attest to this. The fact of the matter is that my interest in behavior management has come a long way. At Teachers College and at university, I learned a lot about behavior management and psychology, enough to boggle my mind, but it is the practice that makes the difference. It was then, it still is. During my years of experience, I have seen many of the worst behaving children grown into successful and respectable men and women, creating, okay, I've seen many, no matter how difficult they were at the beginning, I can open my mouth in awe to see what they have turned out to be in the long run. My son Richard is a prime example. At nursery school, they simply called him bad boy. He was driving me crazy with hyperactivity and misconduct as a young child. In desperation, I had to I had him assessed and received the diagnosis that he was ADHD. He had that factor dealing with a condition that certainly not of anyone's doing, but that he was born with. From then on, I saw that there was going to be an ongoing problem. A child with hyperactivity cannot sit still, running about the place all the time, not listening to what you say. It was terrible. In addition to the ADHD, he had a learning disability. And so after attending prep school for 8 years, he still could not read. It was not until I got him into a special education program that he began to read. Today, Richard is a well-rounded young man, socially accepted, achieving a first degree in information technology and succeeding in a job of his choice. I could not have asked for more. The question is, what if I had treated him according to what one would say he deserved? with his extremely bad behavior. But as I will discuss later, both now and in other sessions to come, you will hear what was the process that changed him from that state to the gentleman he is today. But what about the school level? At school, we have had several children passing through. Shore Foundation Educational Center is established specifically for children with learning disabilities and behavior disorders. And there's a long list that we could reel out in terms of the children who have come through there and have achieved success in life. But let me give you the testimony of one of our past students. He goes by the name Alric. And when you read my book, you will meet him there with much more information than I'm giving you now. This is what he says. Shore Foundation Educational Center is a small school with a lot of potential. I can remember when I first came at this institution. Tell you the truth, I hated this school. It is small. The classrooms are tiny. The children are weird. The teachers are old. I hated it. But even though I hated this school, I could not read or do maths. I couldn't say a proper sentence. The teachers tried to help me, but I was unwilling to receive their help. The teachers showed me love, and all I showed them was anger and hate. I tried countless times to leave the school, but no matter how I tried, I could not leave. I began to misbehave so they could kick me from the school, but it just got worse. The more I gave trouble, it was the more they loved me. That is the testimony of Alric. Alric eventually settled down. After all that, he did well in his examination grade 9 achievement test, well enough to be placed in the country's top technical high school. Today, he is a student of the Michael College University, pursuing a degree in special education. He is just one of the many students who have passed through the school with learning and behavior challenges. And so I say, when our Ministry of Education give the mandate that every child can learn and every child must learn, I respond with my own book to say, yes, they can. It is true. And so we continue to push on in terms of working with these children with learning and behavior challenges. And in this webinar, I plan to share with you more precisely with some of the strategies we have used and what we are proposing that anyone, anywhere, try them, that you will find success. Depends on what we measure success. It may be not from A to Z, but from A to C, and that is still success. So the presentation objectives here, we have inspiration through success stories, which I've started to tell you. We hope you will get that. And in addition, to discover 3 practical steps for behavior change to facilitate learning. Now, the first place that we are going to begin is in the matter of relationship. Training of children begins with relationship. We cannot set out to teach children or to help them to develop in any way while being strangers to them. It has to be clear, indeed, that there is love between the child and ourselves. That is where we will now be in the position to experience success with them. I have learned that very early in the game myself. I've learned that with my own experience when I first started to work with children with disabilities. I had accepted this job with confidence that I had the necessary skills to teach a class. The class was no more than 10 deaf children. I said to myself, if I have 10 children to teach, it doesn't matter what is their disability. I can make them learn. My first day on the job was a complete disaster. No one looked at me, and I could not relate to them unless they were looking at me, because they could not hear me speak. On the second day, I tried to attract their attention by giving them what I knew that all children love. I took them outside for games. That was the biggest mistake. They took the whole compound for themselves, and I had it extremely difficult to get them back in the classroom. When I reached in the class, tired and out of breath from running to catch them, a senior teacher said to me, "You have to let them know that you are in charge." I took that seriously. And at that time, 50 years ago in Jamaica, what that meant was that you give the child a proper lashing for him to understand who is in charge here. So what do you think? I did just that. I got a strap and began to lash them. And this brought down the house of their anger. They rebelled in the most outrageous manner. They tossed the desk and chairs, pointed in my face, and went to the class with the older children to complain and seek help to deal with me. I still thank the Lord that they never struck me, but I learned my lesson. Well, I had not earned the right to discipline them because I had not yet established a love relationship with them. As a matter of fact, I had not established a relationship at all. Now, the teacher who advised me to, to let my authority be felt, she had already established a relationship with them. And so she could do the same thing, and it was quite fine, but not me. I had not yet got to that place. And it is a reminder for me all the time that indeed you must have a relationship with the child in order to have the right to punish the child or to even discipline the child in any way. Children with behavior challenges need extra love and support. In most cases, these children indeed have much greater problems than the rest of us. They are grappling with biological situations, sociological, environmental, and emotional issues. They lack self-confidence and self-esteem. What we see in their behavior is often a cry for help. And so we need to handle them with care. We need to handle them with care. Often their behavior challenges are accompanied by learning challenges, as was the case both with Richard and Alric. And so there again, we must be conscious of this and so know how to deal with them. It's love. It's love. There's a song that says it's love that makes the world go round. And if any child needs love, it's the one who is giving behavior problems. Okay, so teaching the desired behavior, how do we begin that? We begin and in introducing to you the 3 steps that I'm suggesting to help these children manage their behavior and come to a place of learning. So we teach them. That's the first thing. We do not take it for granted that they know how to behave. We give them the benefit of the doubt. We have our expectations of them. We know what we are looking for, but we need to take this time to teach them. So that is the first step. And to do that takes an approach, that takes a structured approach, a planned approach. This should be taught intentionally in the same way that we teach academics. Most children will learn good behavior automatically in the same way that some children learn to read without actually being taught. But the child with learning and/or behavior challenges must be taught directly. The strategy that we use to teach academic skills, we can use the same strategy to teach them. And so I recommend to you the strategy of explicit instruction. And we describe that in terms of sub-steps here. We call it I do, we do, you do. 3 stages. I do it, then you do it, then we do it. I do it, then we do it together, then we allow you to do it. So, I do. That entails modeling the behavior. Our children need to see the behavior that we are asking of them. They need to see it being practiced by us as adults. They need to see it being practiced in the home. To tell them that they are to do it and they're not seeing it would not be the right way to go. It's not a reasonable thing to expect of them. So we do it first, and then we do with them together. We call what we call now, we do shared. We guide them in what we are doing. So yes, we want them to spread their beds in the mornings before they leave for school. We let them watch us spread the bed. They watch us spread the bed. Okay, a number of times. And then we go back and say, come, Mark, let us spread the bed together. Guided practice. We do it together. And when they make a mistake, we correct it together. Okay. And after that now, then we go back now to say, no, you do it. So you have learned how to spread the bed. You do it alone. And we give them the opportunity. Now you must spread your bed each morning before you leave for school. And where they make errors, then we help them. We still help to correct their errors when they make it. And so that's just an example. I'm sure you can think of many other examples. The key thing is that you watch me do it, and then we do it together, and then you do it on your own. When we get to that stage, now we set the rules. We set the rules. Okay, so you have learned this behavior. You have learned this skill, how to do it. Now this is how it is going to be done. This is your responsibility. We are teaching them responsibility at the same time. That is step 1. First step. The second step, we now set the stage for success for them. Having taught them, having given them the practice, and for them to do it, now we want them to succeed. When we set the rules for them, we want them to succeed. And so we are going to do whatever we can to help them to succeed. Success breeds success. Our children need to feel the sense of success. And our responsibility is going to be to help them to get there. And so in that stage, one of the things we are going to do is provide for them clear structuring. Structure is important to structure their time and space, what they're to do, when they're to do it, and where they're to do it. Children love order, and the child with special needs thrives on it. When they don't have an order, they get disoriented, and we will complain. But if you were just to let them know and guide them exactly how to do it and set up a system for them to follow, we would get much better results from all of them. Give clear and concise instructions of what to do, when and where. A place for everything and everything in its place. Again, some of these routines may come naturally for the child without challenges, but for the child with special needs and behavior disorder in particular, they have to be drilled. At times, it may be necessary to break routines and other tasks into manageable chunks and communicating what must be done first, next, and last. For example, on reaching home from school, we are saying to them, first, put your school bag at the place assigned for homework. So we have a special place for them to do their homework. When you come from school, you put down your school bag there. And then you wash your hands and have a snack. After that, you come back to do your homework, or in between, well, reasonably, they should change their clothes first. So let's go it again. You come in, you put your school bag in the place. Over time, they get to learn that's what they're to do. Then they change their clothes and wash their hands, have a snack, and then they do their homework. So if we drill this into them over and over again, this is how you do it. In time, they get to learn it. And that is how we are going to help them to manage as we set up an environment with structure. The next thing we need to do is a matter of consistency. Consistent. We have to be careful about what we are teaching them. We need to be consistent in our values. We need to be consistent in helping them to maintain the rules. So we can't do one thing today and tomorrow we do a different thing. Or we tell them to do this and then we do something different. Repetition is important in learning. And so adults must be careful to follow through with the rules and consequences established. Again and again. As adults, we must do it. If it's something that we are involved in, they must see us do it, and then we must insist that it is done again and again. We do the same thing and then expect them to do the same thing. Failure to do so will send the wrong signal to the children. They will soon read between the lines and know that we are not serious. And that is what happens to so many of our children so many times. This failure on our part will erase all other effort at behavior management. All of what we are teaching, if they can now do something differently and we ignore it, then the consistency is not there. It lacks seriousness. Students are quick to recognize also inconsistency in the way that we deal with each other. If we tell them, give them a pattern of behavior in relationship, but then we do something different, we are sending the wrong message. What we tell them to do in relating to one another, we must do the same thing. When I give you something, you say thank you, please, and thank you. So when they give me something, I must do the same thing. I cannot now say because I am the boss, I am the teacher, then I don't have to do it, but then you must do it. There has to be consistency in our behavior to them as well as there while we are asking them to do the same things. We must understand also that children will make errors. And so we must temper our reactions to them, to their errors. They're not perfect. No matter how much they try, it's not going to happen. And so children with behavior challenges will make even more errors. They will often fail in their effort even if they want to succeed. Jason, a past student of Shore Foundation, was a prime example. He lived in a volatile community. He was boisterous, strong-willed, and disruptive. He rebelled against anything that appeared to be unjust in his eyes and got into uncontrollable rage. He was extremely disobedient, used indecent language, smoked marijuana, and was not afraid to challenge adults. He was disrespectful to parents, teachers, and adults alike. And so we would say that, that this child, he really is impossible. We can't work with him. And prior to coming to Shore Foundation, he had been excluded from 3 schools. He was big for his age and tended to intimidate other students with his size. But meanwhile, he was extremely caring and helpful to both students and teachers. He admitted to his shortcomings and pledged to change repeatedly, but in his own words, he found it difficult to do so. And so the point that I want to make here is the fact that the behavior that children exhibit, it is not always because they want to do it. As Paul says in Romans, the good that I want to do, I do not do. And the thing that I don't want to do, that is what I do. And so it is understanding that these children are struggling on the inside. So when they made a mistake and we blaze out at them, we will never give them a chance, to explain themselves, we are making a mistake. Our school worked with this child until he did the grade 9 achievement examination and transitioned to high school. There are several occasions when we could have turned our back on it, but we never did. Because in him, in the deep inside, we saw there was good in him despite his behavior. And then now he's moved on to the Hard Trust program, where he's pursuing certification in the skill of his choice. I ask us to try not to pay undue attention to the negative behavior that are there, but that we don't dwell on them always, because those children will get discouraged and it tends to bring out the worst in them. If the only word they hear from us is when they are doing something wrong, and so our communication with them is always negative, then they are going to continue into that behavior and to the point of getting rebellious. We must be careful how we condemn them, how we criticize them, and how we complain about them to other people, especially in their presence. And so I emphasize here in terms of our second stage, we do all of what I'm saying here as a means of setting the stage from our side to help them to succeed, right? And prevent them from failing in the process. We'll talk more about that because that's a deep factor. And so that is stage 2. We are just giving you synopsis because it's not possible to do all of that and what we would want you to learn how to do it. And so we come to step 3, reinforce a positive behavior. Now, Dale Carnegie said in a quote, quoting him, there is only one way under the high heaven to get anybody to do anything. That is to make the other person want to do it. In my own experience, I have come to the same conclusion. Quoting from my own book, if there is one thing I have observed in my years of working with children and adults, it is that in the long run, people will always do only what they want to do. No amount of force will bring them into sustained conformity. And that is coming from Yes We Can, 2019. Reinforcing positive behavior is one way of bringing persons to the point of wanting to do something. I say, catch them being good and reinforce that. Many times, what we do, we catch them doing the bad things, and we continue to reprimand them, but they do the good thing that we never see it, and they complain themselves that nobody sees them when they do the good thing. We only see them when they do the bad thing, and see that is when we see them, some of them deliberately go ahead and continue to do the bad thing to get our attention. And so we need to catch them when they are doing good. And then we praise the slightest improvement and praise every improvement. Based on their starting point, improvement may be slow, but it will come. So we must continue to look for them and encourage them. I said before about the matter of what we call success, but even more so improvement. So we have a child who comes to school and his behavior is outrageous, and we are expecting him to change to good behavior. It's not possible overnight. But if he changes, if he makes a tiny step in improvement, then we need to recognize that and say, okay, Tony, yesterday, the teacher had to call to you 5 times, and you got 5 times your name went down for disability, but today it's only 3 times. There's improvement. So we recognize it and we commend him. He still is not behaving well, but he has made improvement between yesterday and today, or last week and next week. So we praise it and recognize everything. And then, of course, we establish a system of reward and consequences. That we will talk about more in our next webinar. I will expand on this. So that's it. What are the 3 practical steps that I want to leave you with? Well, first of all, I want you to understand, I want us all to remember the overall, right, the cover statement and understanding that a love relationship is where we start with our children. That comes first. Then after that, I recommend that you try these steps. Teach the desired behavior. Teach them. Don't take it for granted. Don't condemn them before you have actually taught them how to behave. Then set the stage for success. put the systems in place to help them to succeed. That's what that is saying. And finally, reinforce the positive behavior in whatever size they come. Not altogether maybe what we are expecting them to reach, but where they have made improvement at this time. And so, friends, relatives, teachers, parents, and all those of us on this platform, this is my contribution to you at this time in terms of managing the behavior of your children, our children, the nation's children, because your children belong to all of us. They are the nation's children. Whatever part of the world that you are, that is how it is. Okay. And so the next thing that I'm asking of you, I hope you have been inspired somewhat from what I have presented, and that you are motivated in that to at least try some of it. If there's anything you have heard that you have not tried yourself, and you're having challenges with behavior, whether that's your child or your grandchild or a relative's child, I'm encouraging you to put one of these strategies to the test and report on it to by the email video here, yestheycanacademy, and the first 2 persons to bring that report, we have a special prize for you. And here I now turn back to Ruth, who will take us from here.
Thank you very much, Dr. Ricketts. If you learned anything, send up some hearts, some claps, some reactions in the Zoom room. You should be able to clap and hearts. How was that? I will entertain the questions. We want to thank Mrs. Vendita Mackenzie for doing the interpreting for the deaf community there, and Mrs. Heidi and Mitchell is going to take over at this stage. So Casita said she came late and she was inspired. So remember, you have homework to do, and the first 2 persons to submit their answers by January 3. So you're going to put into practice what you heard. All right. So let me spotlight Heidian so that you can see her signing and then ask your questions. You can also unmute to ask the questions. Let me see if I can find Heidian. One moment. There she is. So thank you very much, Mrs. Mackenzie. So we're spotlighting Heidian now. Questions. I see Tony Shea, you have unmuted yourself. Do you have a question for Dr. Ricketts? You can post questions in the chat or you can unmute and ask them. Everything was clear. We're all experts here. Any comments? Tidra, do you have a question? No? No comments? All experts here. Okay. I have a question for Dr. Ricketts. What age group do you treat with at the Shore Foundation Educational Center?
Okay, we work with teenagers really, starting from age 11 to 21. So these children are children who are at this stage of life where things have started to become more difficult for them, you know, than in childhood. It's that stage where everything in them seems to start to go upside down, break up, and to start again. Yeah, so the age group is 11 to 21. It's young adults,
Thank you very much. Just in case
adolescents. Yes.
person, thank you, Doc. Just in case persons thought those strategies were for little children, you have some. This is what she has done at her school, and she caters for um, teens to young adults. And these are the foundational steps, as you heard from her story. You have to build the relationship. My pastor always say relationship before rules. And what I found interesting is that she said you need to teach the behavior just like you would teach a subject, any other subject. So you don't just lay down the rules, but you teach the behavior, you model the behavior. And that is so important. And we're talking for teenagers come right up, because even your teenagers will say at time, how come you're telling me to do this and you're not doing it? So she said you need to be consistent in that. Any comments? Anybody has any example of applying any of these with success and you want to share that?
I do.
Okay, go right ahead.
Hi, this is Rosemary Stewart, um, Claire's baby sister.
Okay, Rosie. Okay, good to hear you, my sister.
Okay. I remember one day while I was at work, I met one of the nurses at work. He was sitting on one of the park benches outside smoking. And I was on my way home and I saw him there smoking. And I know that he has some boys that he was talking to me about, you know. So I said to him, you know, you were telling me about your boys and what you don't want them to do. And so if you are doing this, I hope you're not telling them not to do it, because you can't be doing it and then they're gonna listen. So immediately I started to tell him about one of my son who started smoking, and his father used to tell him, do not smoke, do not smoke. But in the same breath, he was doing the same thing right before his very eyes. And the child grew up smoking eventually. So it's the same thing that Dr. Clara Ricketts is trying to say, that if you're gonna tell them to do, then you have to be modeling the behavior.
Okay.
And he was very you know, his emotion, he was getting emotional over it, because it didn't hit him until I said it to him. And what do you know? Months later, he quit smoking.
Wow.
Yeah.
Okay. Thank you, Rosie, for that example. Because yes, you hit it on the head, and there's a live example. The fact that the children learn what they live, you know, and so we have to remember that. So thank you for that example, reminding and reinforcing the fact that they are going to copy you. They are going to copy you, and so you have to model the behavior that you want them to adopt and follow.
Thank you so much. Sophia raised her hand. So go ahead, Sophia, and share, ask a question or comment.
All right, good evening. You're hearing me, right?
Yes,
hello.
we
are. Okay, good evening. I'm a caregiver at the Salvation Army School for the Blind and Visually Impaired. And as I was interviewed today by some students at JTS who are doing disability studies, and the question that they asked, what encouragement would I give for someone who is seeking a job at that organization? And just as Dr. Ricketts has mentioned, love relationship. I told them the person have to love children first, because if they don't love children, they are going to have a problem, because you have to love children and love what you do. You understand? Because if you are a bus driver and you don't love driving, you will have a problem driving the bus, right? And in order for, and they asked, I was saying to them that you don't have to hug a child and to kiss a child, hug someone or kiss them for them to know that you love them. But the treatment that they receive can show that you love them. They can feel it. They can feel a sense of love. And what I agree with Dr. Ricketts 100% with the love relationship. You have to start from a love relationship with the child first in order to get the child where you want them to go.
Okay, okay, good. Thank you for that confirmation. Thank
Thank
you
you
for
so
that.
much. We have a question here, Dr. Ricketts, from Cas- Casito. She
Yes.
says, I have a stepson and I'm seeing some special needs signs. His dad is scared to get him tested. But how do I treat with children who take forever to write, respond, and react to others? How can she address that? And the child in question is 6, and there's a part 2 to that. Do they normally grow those behaviors? Stares, slow to react or follow instruction. He's scared of a few cartoon characters. Takes forever to write. So how
Oh,
does she treat with such a child?
okay. Well, I agree that the first thing that is going to be necessary is to have that child tested. We have to test the test. We may take advantage of what facilities are available to us, what services are available to us. When we do the test on the child, they are professionals and of every discipline and every kind is there. Psychologically and psychiatric treatment is available. And then from educationally now, then we will get guidelines as to how to treat, because you have to treat the child based on where his needs are. So the first thing that we must, and what is the real needs of this child? We cannot say because he's doing A or B, then we'll put a label on him to say he's this or that. We need to do the test. So my first recommendation is to have that test done. And you said that whether or not he will grow it out. Well, if the child has a disability with which is coming from birth, then he's not going to grow it out. If it is something that has been acquired environmentally based on his environment, and so the behavior is based on what he has seen and the culture and how he interacts with the culture. It's all of that can help to create the disability in the child. Okay, but that is not as often as the cases where it is coming genetically. Some of this is coming, it's genetic, and other type of psychological inborn coming from far back. So for something to say that they will grow it out, they may not grow it out, but they can control it, learn how to manage it, learn how to manage that behavior. That is what they learn to do. And that is what we teach them, how to manage their situation. So Richard, for instance, knows that he's ADHD, and now he's at a place where he can manage himself, but it doesn't change the fact that he's still ADHD. That basic, the syndrome that goes with it is still there, but then he learns how to control it, and that is what we try to teach them and to help them to do. they don't grow out the disability.
Okay, thank you so much, Dr. Ricketts.
Yes.
I trust that that has been helpful. Another question is, other than Michael, where else can they go for testing?
There are a number of private places that they can go for testing. There are a number of persons who are doing psychoeducational tests, and I won't want to do that now by telling you, I mean, where the places are, but then we can arrange to get that information to you outside of this forum. I don't want it to be misconstrued that we are using it in a different way. But there are private places that you can have tests done apart from the NICO. The Ministry of Education does some preliminary tests, but if you needed to get both in the, generally, in the regions, region 1, for instance, you can get some preliminary tests done. At the special education unit, you can get some preliminary tests done, but a full-fledged test, yes, you still have to go to NICO or one of the private places.
Thank you very much. Good questions. And is there anyone else? Somebody is mentioning May West right across from St. Andrew Prep is a good place.
Okay, okay, thank you
M
very
West.
much.
It says M West.
Okay,
Right. That's a
okay,
good place.
okay, wonderful. I thank you.
Right.
I didn't set out to do the advertisement myself, but I do send my parents there to M West as one of the places. Yes.
Right. And you can always email yestheycanacademy to get some more details. We're just going to take another comment. I see 2 participants' hands are raised. Let me find them and have them. All right. Sophia's hand is raised. Go ahead, Sophia.
No, that was an accident. Sorry about that.
Okay. The other person who raised her hand, I'm not again. All right, so here's another place. The Lisa Playfair at Seymour Place is another one. Good.
Okay.
All right, and as we said, this is the first in a series of webinars, and you know Dr. Ricketts has Yes They Can, Shore Foundation Educational Center, but she's also establishing a school online named after her book, Yes They Can, to offer more help. And we have a course coming up called Yes They Can that will be offered in January 2021. We'll provide more details later. But our next webinar topic is 5 tips for setting up a behavior management program at home and at school. So today we gave you the foundation. The next webinar, which comes up in January, I believe it's January 5.
Yes.
For some reason, right, January 5. You're on the list, so we'll email that to you. And this is being shown on YouTube, so we'll send a link that you can rewatch this as well. So we're going to give you 5 tips for setting up a behavior management program at home and at school. So we're going to get more practical in our next session. Let me check the chat, the comment there. Okay, just person saying thank you. So we have a course coming soon, which has to do with Dr. Ricketts' 7-step roadmap that she's used to help children and young adults with behavior challenges, learning disabilities to learn and to thrive. And that course is coming in January. Now, based on the 3 steps that we shared today, we want you to employ at least one of them and report to us at yestheycanacademy Let me put that back there at gmail.com by the 3rd of January. And then the first 2 persons to respond in terms of trying to implement those steps in even a little measure and give us the results by January 3, so you have over a month to practice, you will get a discount on the course that we have coming up. You'll get 50% discount on the course we have coming up in January. I see Nicole has raised her hand. Go ahead, Nicole.
Hi, good evening, everyone. My name is Nicole Wickham. My daughter attends Shore Foundation. She's actually in her 2nd semester. I know this evening webinar was on mostly behavior and how behavior, shaping the behavior to help with the learning. One question I just want to ask before we close: what happens if your child don't have a behavioral problem, but they have a learning challenge? Do we address it the same way in which we address persons who have behavioral challenge that affect their learning?
Okay. No, it would not be in the same way. But the only thing is that what we have found over time is that most of the children who have behavior problems, invariably, they also have a learning problem. Now, the other way is not so. They can have a learning problem, but they don't have a behavior problem. And so in the case of your the child, Miss Wickham, it is true that she does not have a behavior problem. No, we do not, in terms of that, to treat them the same, because the system that we put in place for behavior, it's applicable to all children. So the child who doesn't have a behavior problem, they will still benefit from the discipline that is being expressed or used, that all persons can use at any time. But for the person who has the behavior problem, it's just that you have to do more of that. Your program there for those children have to be more intense. What we are saying now, it has to be more intense, because those children need more. But the child with the learning problem alone, no, you're helping that child to learn. But the methods that we use for behavior, we also use them for learning. We do, you do, that simple procedure there in terms strategy, in terms of teaching. We say it's applicable to learning academics as well as learning for behavior. So we would be using that strategy, but the emphasis would be more on the academics than on the behavior, based on the special needs of a child.
Okay. We trust
Does that answer your question?
Thank you so much, Mr. Ricketts.
Okay.
I know that some institutions, they treat everybody in the same realm. We know that the coronavirus has taken over. So to be honest, Tiana has not really had a full session with the in-class learning. So I just wanted to just ask, so other persons who might be new or other persons who might be here for the first time or listening elsewhere, they will understand that not one cap fits all.
Good, thank you. That's perfect. Okay. Thank you, Ms. Wickham, for your contribution.
Thank you. We're gonna wrap up shortly. Richard, your hand is raised, so go right ahead.
Well, my question was answered in both Ms. Wickham and the person who works from the Salvation Army. So thank you very much.
All right, thank you. Anybody else has a burning comment before we... Oh, Shanalee, sorry. Shanalee, go ahead.
Good evening, everyone. It's not really a question, but so much as a comment. So I am proud to say that I'm a proud member of the Shore Foundation Educational Center family. It was a pleasure working there with Auntie Claire and the rest of the teachers. But when I left, I took the strategies that Auntie Claire would have shared with me when I was teaching there into the public setting. So as we know, it's a little bit different there. The numbers are not as small, and as a teacher, you can't diagnose to say this child has a behavioral or learning disability, but you can look and you can see signs and you can say probably this is where it's going to go, or you can look to say, you know, this child is behaving a bit different from the others. So when I went into the public setting and I was thinking, how can I address these students and ensure that even though the strategies were for special needs learners, how can I apply this to the regular setting? So I started out and I applied the reward system. So even though it was a larger number where I had to take into consideration, you know, getting tokens for them and matching them with their learning profile, or that's right. So I still went about it and I had to adjust it a bit. So I adjusted to suit my students and to suit the class setting, but it actually worked. I remember one particular student who was not really fond of the whole learning process. So when I introduced the reward system, the token economy, there was a drastic change. There was more eagerness to learn and you could actually see the improvement. When I got him, he was reading at grade 2. And when I left him at grade 6, because I got him for just a couple of months. I had him for, I think it was 6 months. I had him for 6 months. And when I left him at the end of the 6 months, he was reading at grade 5. It was a short period of time, sure, but the development that he really, really great. He was willing to come early.
No, you waste the water. You couldn't put it in our...
extra classes and during his lunchtime, because at that time they were preparing for GSAT. At that lunchtime, he would be in class and he was willing to work. And, you know, it was just really great to see that something that really catered to the child and let the child want to learn. So I know for a fact that even though the strategies are for the behavior and slow learners, it can still be applied to the regular system to ensure that effective teaching learning is taking place.
Okay. Wow. Thank you, Shaunalee. Thank you so much for that encouragement, that and testimony that the strategies you do work, and not just in one setting and it's amongst one group, because you're talking now about children who are not classified with a disability at all. And yet, I mean, the strategies work, which confirm the fact that I'm saying that they are for all children, but then you made the adjustment based on your children there, and that is how it works right across. So thank you for that confirmation.
All right. Thank you so much for coming. Spread the word. As you heard, the strategies can be applied to all children, and we laid the foundational strategies this evening. Next week, next webinar, we're going to give you some practical tips. And remember, first person to apply even one of these strategies since the webinar, not that you are doing it before, but since the webinar, to apply just one of them and send us an email to report on that, the first 2 persons, you're going to get 50% off the course that we have coming up in the new year, which will flesh this out some more. And we'll tell you more about that at the next webinar. But now is just to sensitize and to help more persons, because we know people are struggling now during COVID, especially, you know, parents at home having the children to deal with more than they normally would. And so we just want to offer this to you to assist you. See this as our little Christmas gift. For more information, you can buy the book on Amazon or go to Brian's, and then see you again January It's January 5. We'll update you and spread the word so that we can have a full house next time. We want to thank Heidi and Mitchell and Mrs. Vendita Mitchell Dillon and Mrs. Vendita Mackenzie for being our interpreters. And thank you for coming. Thank you, Dr. Ricketts. Love the presentation. Thank you for those who attended for bearing witness and sharing your own experience and asking questions and making it rather meaningful and practical. Have a good night, everyone. God bless.
Okay.
Night.
Yes,
Bye.
thank you.
Hi, Claire.
Yes, is
Love
that
you.
Rosie?